Thousands more vaccine doses arrive in the capital, police investigating yet another traffic fatality, and police uncover millions of dollars in cocaine. Good evening, everyone. I'm Leah Cooper with your JCN News for this Tuesday, March 30th. 33,600 doses of the AstraZeneca vaccine landed here in the capital this morning. These came via the World Health Organization and the Pan American Health Organization COVAX facility. The country made a down payment to that facility last year. This batch represents the first tranche of a total of 100,800 doses earmarked for the country and prepaid through the PAHO revolving fund, according to the National COVID-19 Vaccine Consultative Committee. Here's PAHO WHO representative in the Bahamas and Turks and Caicos, Dr. Eldana Boysen.
Now, while there's reason for hope, we must always remember that the vaccine doses are limited, and it will be several months before we can rely on vaccines alone to control this virus. Although scale-up of vaccination production has begun, we know it's not enough. We do not yet have the vaccines that we need to protect everyone. It's what happens when the whole world must rely on too few manufacturers. Our goal at this time must be to save as many lives as possible by prioritizing the early doses for those who are at highest risk of infection, of hospitalization, and of death due to this virus.
Prime Minister Dr. Hubert Minnis, in his remarks, says as more Bahamians receive the vaccination, we must continue to adhere to health and safety protocols outlined by the Ministry of Health. That's wearing a mask, washing your hands, and keeping a distance of 6 feet from others. And as we gear up for the long holiday weekend, Dr. Minnis urges the public to avoid large gatherings.
Large gatherings over this weekend could set the country back. If we continue to exercise discipline for a longer time, we will reap the benefits. If we continue to practice the preventative health measures and at the same time vaccinate more people, we will move even quicker toward a broader reopening of the country. We will get there in a shorter period of time if we do not have to control outbreaks.
The Prime Minister adds that the country cannot afford a painful third wave, resulting in more hospitalizations and deaths. He also says that at this time, health officials are monitoring outbreaks on Eleuthera and Grand Bahama.
The vaccination program will be accelerated to address the increase in cases. Surveillance efforts will also be stepped up on islands where an increase in the number of cases is being recorded. Vaccinations are starting on Eleuthera today, Tuesday, March 30th. They will continue through Thursday, April 1st, starting with the healthcare workers, residents over 60, and staff of the uniformed branch. Vaccinations on Abaco and Bimini are expected to start next week after the Easter holidays.
He says that health officials are closely monitoring developments and assessments are being carried out on the islands where outbreaks have been recorded. Following various assessments slated to come in next week, the Prime Minister says the government may take further steps based on the findings. Vaccinations will continue this week on New Providence, Grand Bahama, and Eleuthera leading up to the Easter holiday. After the holidays, vaccinations will resume on Wednesday, April 7th. At this time, those with disabilities, teachers, and hospitality workers will become eligible to receive the vaccine. Meantime, Prime Minister Dr. Hubert Minnis is urging the public that if they're going to enjoy the beach this holiday weekend, limit your group to 5 individuals or less living in the same household. He says this much off the heels of an uptick in cases over on Grand Bahama and Eleuthera. He's also calling on Bahamians and residents to make some sacrifices in order to enjoy holidays in the future.
If we were to make the sacrifice in terms of the mitigation processes that the health professionals and the World Health Organization had introduced, if we were to follow those procedures and do our part, and each citizen be a soldier of the Bahamas doing their part and stopping individuals from gathering, if we were to make that sacrifice for an additional 2 weeks, then we can have a beautiful independence and a marvelous and splendid Christmas.
Asked to respond to those that may think prohibiting large gatherings contradict campaign activity from political parties over the past few weeks, Dr. Minnis says this.
You would have seen them still spacing out somewhat, and each and everyone, regardless of the political organization, each and everyone were wearing a mask.
He says this much following the arrival of the first batch of AstraZeneca vaccines purchased last year from the COVAX facility.
Absolutely, but it's very, very important, and the health professionals, neither you nor I, are in a position to know or to opine on what is the best test or not, and they have decided that to travel from New Providence and Grand Bahama, you need a PCR test. It is absolutely critical that we prevent as best as we can any growth in COVID cases in the Family Islands, because the health facilities just do not exist.
That's Tourism Minister Dionisio de Aguilar responding to the media's questions just before the weekly cabinet meeting on whether his ministry considered implementing the rapid antigen testing versus the RT-PCR test for those persons who are inter-island traveling. On Monday, 11 persons appeared in the magistrate's court for allegedly being in possession of false COVID-19 tests and attempting to travel to various Family Islands this past Friday. When asked if tourism officials were looking to formally put in place a system to detect if a COVID test is fake or not, the minister did not give a direct answer. However, he says this.
I said before, disappointing that you take those measures. They are in for a reason, to prevent community spread. Please abide by the rules and not try to deviate from them. That is why we are probably, to a certain degree, having some uptick in our COVID numbers.
With the AstraZeneca COVID-19 vaccinations in country and more people becoming vaccinated, the minister was also asked if the country could possibly see a move to the rapid antigen testing once persons receive their second dose of the vaccine.
So the studies are beginning to show, although the science is not yet complete, that when you get vaccinated, it prevents you from getting sick, and it significantly diminishes your ability to spread the virus if you're infected. So if you get infected and you have been vaccinated, A, you won't get sick, and B, you are less likely to spread the virus onto someone else.
The requirement for all individuals traveling into the Bahamas or throughout the country is that one must obtain a COVID-19 RT-PCR test 5 days prior to travel, along with a Bahamas travel health visa. You're watching JCN News. Stay with us.